Marijuana warning labels. I'm Dr. William Meggs, a medical toxicologist, a medical doctor who specializes in treating poisoned people. Like any drug, marijuana has the potential for bad reactions and should have warning labels so that people know the risk. One of the arguments for legalization of marijuana is that it is no more dangerous than alcohol or tobacco, and they're legal. Yes, but they have warning labels, as should marijuana. Legalization of marijuana has led to an increased belief that its use is safe. Studies have shown that since legalization, the public has suddenly swung to thinking it's a very safe drug. But as we'll see, it is not a benign drug. Legalization has led to increased use. A good thing is that legalization has led to increased research. It's hard to do research on a criminalized drug. We're also hearing more about the problems associated with marijuana use. Warning: children should not be exposed to marijuana. Marijuana can be very dangerous to children. Toddlers find the marijuana edible. Marijuana delivered as candy or brownies and eat it. They get somnolent and stagger when they walk. Symptoms progress to, with large ingestions, they can go into a coma and end up in an emergency department. They get CT scans, MRIs, and spinal taps. Then the drug screen comes back positive for tetrahydrocannabinol, THC, the active ingredient of marijuana. It is incredible that state legislatures legalize marijuana, and in particular the edibles, without requiring child-proof containers. Warning: marijuana should not be used by women who are pregnant or breastfeeding. The American College of OB/GYN has a position statement based on a scientific literature review that recommends that marijuana not be used during pregnancy and lactation. THC crosses the placenta and gets into breast milk. Studies have shown that children exposed to marijuana while in the uterus have learning disabilities even by 5 years of age. Warning: marijuana use is associated with acute psychosis and other mental illnesses. There's a condition called acute marijuana psychosis that I first encountered while a medical student in the 1970s. When these individuals are exposed to marijuana, they become acutely psychotic and can end up being admitted to a psychiatric ward. When the marijuana gets out of the system, they become normal until they use marijuana again. A study in Denmark found that 40% of individuals with acute marijuana psychosis progress to chronic schizophrenia. A study in Toronto found that adolescents, but not adults, who use marijuana are 11 times more likely to develop schizophrenia or other mental illnesses. Marijuana should not be used by people under the age of 21. My fear is that the legalization of marijuana will lead to an epidemic of mental illness. Ongoing research will provide further answers. Warning: marijuana use is associated with cannabis hyperemesis syndrome. Hyperemesis just means severe vomiting. These individuals have attacks of severe vomiting, abdominal pain, and an inability to keep any fluids or nutrition down. They come to the emergency department with severe dehydration and require IV fluids and potent medications for vomiting and pain. Sometimes they require admission to the hospital. They are told to avoid marijuana, but some don't and keep having attacks. Warning: marijuana smoke contains cancer-causing chemicals. Chemical analysis of marijuana smoke has found that it contains the same cancer-causing chemicals found in tobacco smoke. With increased use, marijuana research will clarify the risk. Warning: marijuana can be addicting. On a scale of addicting substances, marijuana is not as addicting as nicotine, cocaine, amphetamines, alcohol, and opioids. However, after legalization, there's been an increase in individuals seeking substance abuse visits for problems with marijuana. Cannabis heavy users can have withdrawal that is usually mild, self-limited, and resolves within several days without needing medical attention. Common signs and symptoms of cannabis withdrawal include irritability, anger, anxiety, depression, restlessness, sleep difficulties, decreased appetite, weight loss, abdominal pain, nausea, vomiting, muscle aches, twitching, shakiness, tremors, sweating, and headache. Withdrawal may contribute to resumption of or continued cannabis use. Warning: marijuana smoke can damage lungs. According to the American Lung Association, smoking marijuana clearly damages the human lung, and regular use leads to chronic bronchitis and can cause an immune-compromised person to be more susceptible to lung infections. In summary, users of marijuana should be warned of risks through warning labels. These include risks to children, risks to unborn children when used during pregnancy, risks to breastfed infants, risk of mental illness, cannabis hyperemesis syndrome, cancer, lung disease, and addiction. Here are selective references to the peer-reviewed medical literature, just to let you know I didn't make any of this up. More references, and even more. Thank you for your attention.